Ritika Mandavilli.
I'm Shriya Mandavilli.
I'm Dhruvi Patel.
And I'm Diya, Shah. And today we're here to talk about our experience with teaching high school students about one of the most prevalent issues of our time. Almost everyone is familiar with this name. Not only has it affected the lives of millions in mere months, but it has also caused a significant societal change by shutting down many public areas, such as schools, offices, and small businesses. So what exactly caused this drastic change that's affecting us all? The coronavirus pandemic. Coronavirus is a large family of viruses that are common in people and several species of animals. Specifically, SARS-CoV-2 is a zoonotic severe acute respiratory virus within the coronavirus family that is currently circulating and causing the COVID-19 disease, with over 6 million cases worldwide and hundreds of thousands dead.
Symptoms from COVID-19 include mild to severe respiratory illness, fever, and shortness of breath. An extensive list of these symptoms can be found on page 5 of our portfolios. Unlike common colds, COVID-19 symptoms can appear 2 to 14 days after exposure, and some patients may be asymptomatic, which is dangerous because these patients may end up spreading it unknowingly. Most coronavirus patients suffer from mild to moderate disease and then recover. However, other critical patients may suffer from respiratory failure, septic shock, and multiple organ dysfunction.
With our lesson, we aim to help high school students learn how to protect themselves from this perilous virus. We did this by teaching them about the coronavirus in order to get rid of common misconceptions while also showing them which preventive measures to take. We also delved into the science behind coronavirus and how biotechnology is playing a role in developing treatments and vaccines for COVID-19, since all our participants are biotechnology students like ourselves. A detailed plan of our goals can be found on page 2 of our portfolio. Now, I know you all might be thinking that information about the coronavirus is all over the news on a daily basis. So why would we focus on COVID-19?
Well, that in itself is exactly why we chose this topic. There is so much information out there on the coronavirus that teens may misinterpret that information or receive unreliable information from unreliable sources. As such, teens may remain uneducated and misinformed and all the more susceptible to the coronavirus. Unfortunately, many teenagers also believe that ignoring social distancing protocols and going outside and hanging out in large groups is okay and safe. Therefore, we believe it is crucial to inform them of the gravity of the situation so that they can properly follow these preventive measures. A more detailed explanation of these preventive measures are found on page 7 of our portfolio.
Overall, with the shutdown of schools and public facilities, this virus has caused students all over the world to miss out on important milestone events such as graduation, last school dances, and farewell ceremonies. It has also unfortunately taken the lives of many beloved friends and family members. So, with our lesson, we truly hope that it allows students to understand the risks of and how to properly protect themselves from COVID-19.
Once we decided on our topic, we moved on to planning our lesson. We created a list of every subtopic regarding COVID-19 and then divided them up between the 4 of us. I focused on the prominence of COVID-19 and general information. Ritika focused on prevention and precaution methods as well as how the virus spreads. Shriya focused on treatment, vaccine, and diagnostic tests. And Dhruvi focused on strains and virology. The in-depth information about all of these are starting on page 4 of our portfolio.
Using the information we researched, we compiled a presentation embedded with fun, informative activities. Much of our research consisted of biotech concepts such as gel electrophoresis, so we had students conduct a lab relating to diagnosing COVID-19 so that they had an opportunity to utilize their biotech skills. A more detailed plan of instruction is found on page 3 of our portfolio, and our lesson outline is found on pages 8 to 11 of our portfolio.
Before our presentations, we prepared the lab equipment and made the mock serology test. On the day of our presentation, we first introduced ourselves and gave out our pre-test. We then explained the protocol for the mock real-time PCR test and allowed students to load their gels. While the gels were running, we went through our presentation. Afterwards, students worked on the mock serology test. Following our lesson, we moved on to our 3 interactive games and our poster-making activity on prevention and awareness of COVID-19. These posters were then hung up around the school.
More details can be found in the lesson outline on page 10, as well as on pages 14 and 15 of our portfolio. Next, students stained the gels from earlier, and then we held an engaging hand-washing seminar with the students. After the gels were ready, students viewed them under the light box to determine which patients tested positive based on the band lengths. At the end of our lesson, students took a post-test and survey to assess how much they learned and how well our team performed. We also gave handouts with symptoms of the virus and preventive methods.
Because information has been updated since our original presentation in March, We recently updated our presentation and made a video of us going through the slideshow using screen sharing and screen recording features on Zoom in order to inform students about these updates. Students were then assigned a post-test on the Schoology platform. If you refer to pages 19 and 20 on your portfolio, you can see the quiz.
Overall, the value of our lesson to our audience is that as children get older and enter high school, they hold more responsibility in caring for themselves. In this specific circumstance, it is crucial that they understand this so that they can protect themselves and others around them, since the virus is very much still active. And yes, although our parents are still here, we are now aware enough and hold more responsibility in caring for our own selves and making our own decisions regarding our own health.
And even if only a few of these high schoolers make the choice of staying home and social distancing, it could potentially save someone's life. Thank you.